Welcome to Local Business Spotlight, everyone. I'm Troy Thompson. I'm over here at Life Care Centre of America, and I'm speaking to one of their PT trainers, and his name's Josh, and we're talking all about physical therapy. Welcome to the show, my friend. Nice to meet you.
Thank you, Troy. Appreciate it.
Okay, why did you get into physical therapy to begin with?
Sure, great question. I've been a physical therapist for 12 years. So played college sports. So I was injured as most college athletes.
Right.
So that was my introduction to physical therapy, was while I was playing college sports.
All right, explain to everyone at home what physical therapy is, because I want to say this. Sometimes they get it confused with personal training,
Sure.
and they also get it confused with chiropractic.
Yes.
So let's just break down what is physical therapy.
Physical therapy, one word definition would be movement. The physical therapy profession, the association, has a vision statement that says, transforming society by optimizing movement to enhance the human experience.
Right.
But it's optimizing movement is essentially physical therapy.
What is the need for physical therapy?
It's really robust. So physical therapy looks different in each setting. So you have acute care settings, you have pediatric settings, you have outpatient settings. We're a skilled nursing facility post-acute care setting.
Right.
So in our setting, it's a lot of geriatric care. So patients usually above the age of 60. We do have some 40-year-old patients that have a variety of issues and come to us for rehab needs, but a lot of it is geriatrics.
Well, tell us about the life care program of physical therapy that we have here on location. It looks amazing, I have to say to you. You've got it. Sometimes it looks a little bit better than my own gym.
Thank you. So at Life Care Centre of America, we have a multidiscipline rehab team. So speech therapy, occupational therapy, and physical therapy. Physical therapy, a part of that, works within an ID team experience to make sure we're providing all the needs for the patient. So from a physical therapy perspective, it's movement, it's transfers, bed mobility, walking, stairs. How do I get a patient that just had some type of injury home to resume some form of normalcy of life?
So this isn't necessarily in-care work. This is people that are maybe injured from outside who then come in and have physical therapy, or are you looking after your own patients only?
Yes, sir. So both. So this setting offers both inpatient and outpatient. Some of our facilities, depending on the community that they're in, the needs of that community, we have just inpatient settings where they only help folks from a hospital setting.
Okay.
So more inpatient focused, skilled nursing. And then we have facilities that are hybrid post-acute care that do outpatient as well as inpatient.
So Josh, give us an example of a particular injury that someone would have been needing physical therapy. Is that hip replacements? Is it knee replacements? What are you actually physically doing here?
Yes, sir. All the above. So
really?
we have orthopedic injuries, neurological injuries, general immobility concerns, different comorbidities. But if you take just a ischemic incident where someone has a stroke, they're going to have mobility needs physically. They're going to have physical therapy needs to help them with bed mobility, transfers, walking. Occupational therapy is going to help them with activities of daily living. Speech therapy is going to help them with swallowing and some other concerns. But PT is focused on movement.
Josh, I want to ask you, because this is quite a lovable thing that you're doing, because getting someone back on their feet and be able to live at home and have a normal life, what is it that you love about being a physical therapist?
Great question. So with our company and my personal values, they align fairly well. And part of the values of the company, it says, in the way that you serve others, you are demonstrating your obedience to God. So for me personally, I know in my service to others, I'm helping people and I want to help people. And I get a chance to do that every day.
It must be very rewarding to see them go home without being in a wheelchair or be able to speak again.
Absolutely. Different settings, you're rewarded differently. Some sports management settings or outpatient, you may help an athlete return to sport faster. Here, we're helping patients that have not been able to be with their spouse for 2 months because they fell and fractured, to be able to go home and resume some type of normalcy of life.
Josh, thank you so much. We really appreciate you. Absolutely. If you want to find out more information about Life Care Centres of America, there it all is up on the screen for you.